And the reason I haven't continued to do live seminars is because in that seminar we had mostly women. And so I thought, well, doing it by webinar, this will be for anyone who's listening, and if you want to share this with others, this is going to be the only time that I actually do talk about men's hormones in a seminar format. So I think I agree, David. It's just as important for men to balance their hormones as it is for women. I've been doing a lot of research over the last few weeks, and I'm working with some men who are balancing their hormones with the program that I'm going to outline. For those of you that are medical that are on here, I'm going to use very simplified terms. I'm not going to go into lots of detail, but with having said that, for those of you that are on the call, there is lots of information. So I think I want to begin. We're going to talk again about the 4 areas that I think are relevant to balancing hormones. One is to have an understanding of how our body makes hormones. Another one is to understand what happens when they go out of balance. And I will say this about men and women's hormones. There's a lot of similarities, but there are a lot of differences as well. And so when we talk about estrogen dominance for men, it implies a whole different panoply of hormones than it does for women. Current medical solutions, we'll talk about some of the drugs that are out there for men. We'll talk about some of the surgical procedures that are out there. I'll dabble a little bit in what's being offered as far as bioidentical hormones out there as well. I won't go into lots of detail, but enough that hopefully this will whet your appetite. And then we'll talk about a natural solution. The one thing that I've learned through all of this is that I believe that the majority of men, when they reach the age of 60 or 65, ultimately their hormones are going to go out of balance, and that balancing hormones for them is going to be just as important a key for their health and wellness in the following couple of decades as it is for women. With having said that, again, I've got a book list at the end of this, and anyone can email me, ask me for a book list. You can go on to helpforhormones.com and request a book list that is specifically targeted towards men. I believe that education really on this issue as well is the key to hormone health for men. But with having said that as well, I'm not convinced that men are going to take this initiative. And there's a couple of reasons. Number one, I think that even though hormones affect the mind of a man, the body of a man, they are very sexual for a man. And that is a very personal issue. That's not so much the way it is with women. And further to that, women talk more. This is much more personal for men. So let's start by, again, addressing the issue of how does our body make hormones? First of all, we could probably ask the question, what are hormones? And Dr. David was correct. They are really chemicals, but they are actually chemical messengers that transport information from our brain to all the glands in our body. And that holds true for both men and for women. And then from the glands, the information goes to the cell, and then from the cell back to the brain. So it's a loop system, if you would. Now, hormones rejuvenate, they regenerate, and they restore our body. That could be the 3 R's of hormones: rejuvenate, regenerate, and restore. And so with having said that, they are actually imperative to life. Now, you know, most people don't realize that all of the steroid hormones, estrogen, progesterone, testosterone, DHEA, even cortisol, are produced because there is an adequate amount of cholesterol in our body. I think that with the push towards encouraging people with high cholesterol to go on statin drugs, I think we're going to see some failure happening as far as hormones are concerned. And in that, cholesterol is getting kind of a bad rap. So it is really important to understand that having too much cholesterol perhaps can be a heart risk, although that's now being questioned. But it's also dangerous to have too little cholesterol. and in fact, without an adequate, and that's a key word here, amount of cholesterol, most of us will not be able to function and function well. Cholesterol is essential for a number of body processes. Trying to find my arrow here. It seems to have disappeared. Anyways, it's needed to produce vitamin D, which is also important. It's needed for the absorption of, which is used for the absorption of fat in the intestines. Cholesterol is needed for the myelin sheath that coats the nerves in our spinal cord and in our brain. So, you know, it's not just about hormones, but it really is important because it's the main building block for all of the hormones that our body produces. All right, so let's look at the next slide. Pregnenolone is the next hormone that's produced from cholesterol. Now, pregnenolone is more of a precursor, and we're not able to get a lot of research on pregnenolone, but we understand that perhaps it acts as a catalyst. By adding it, it is not really proven to elevate, for instance, progesterone, which is the next hormone in the pathway. So I'm suggesting here that the addition of pregnenolone doesn't seem to change. When we do saliva tests, for instance, and somebody gets pregnenolone, we don't see an elevation in progesterone. So we're not sure of pregnenolone's role, but we do know that the next hormone on the pathway, progesterone, is a very important hormone. Now, progesterone is a neutral hormone. We don't want men to think that because it's named the progestation hormone for a woman, that it is not appropriate for a man. But progesterone is a neutral hormone. It has neither male nor female attributes. Now, progesterone for men is made in the adrenals, and they make about half as much as a woman does. That's just about 10 milligrams a day. In men, progesterone has a number of important regulatory functions that affect the production of estrogen and DHT, or dihydrotestosterone, which you'll learn a little bit more about later. Progesterone is an aromatase inhibitor, and you'll learn more about that word as well. It curbs the production of excess estradiol. So we can look at progesterone as an inhibitor of estrogen in a man's body as well. Another enzyme that's going to become important when you understand that testosterone converts to DHT. From progesterone is produced cortisol, and so far this pathway is identical to that in a woman. And what we understand about cortisol is that's our stress hormone, and I guess I would ask anybody who's listening to this presentation, what's your stress level like? Because the doctors that I've encountered all believe that excess stress overproduces cortisol, taxes our progesterone stores because progesterone is required to make cortisol, and leaves us with imbalanced hormones. So stress probably for both men and women will be the #1 factor that causes a problem for us hormonally. Dr. John R. Lee believed that stress was the main reason for men's hormones to go out of balance in women's as well. The idea of excessively producing cortisol and diminishing our progesterone might be a new thought, so we'll let that one percolate for just a little bit. High stress also inhibits testosterone levels in men, and you can see that from progesterone is produced testosterone. If too much cortisol is being produced and the progesterone is being shunted in that direction, then there's not enough to produce adequate amounts of testosterone, and we'll see that stress can again have effect on another hormonal pattern. Testosterone, of course, is in a man is the main male hormone, but women have it too. Testosterone is a very potent sex hormone, and because of that, of course, it has implications with sexual function. Testosterone is produced in the testicles and in the adrenal glands, and it's carried in the bloodstream by sex hormone binding globulins. Now, SHBG for short, a protein that's produced in the liver, which carries hormones to the tissues. Now, too much SHBG can cause too much testosterone to bind. And so we know that testosterone that's bound is not going to be available to receptor sites. We'll come back and talk a little bit about that because there's an estrogen connection there. Testosterone is primarily an anabolic or a building hormone, and it's responsible for male characteristics such as facial and body hair. It's responsible for a deeper voice, building and maintaining bone density, and for increasing muscle mass and structural connective tissue, as well as it plays a role in the mind of a man with their competition and drive and stamina and their general outlook on life. So normal levels of testosterone are what everybody would be looking for and would be required. There are many studies. I'm going to be referring to a number of them. I've posted lots of them at the end of this presentation, but there are many medical studies that have linked low testosterone with a higher death rate in men, men over the age of 50. And I think that what we're going to show is that the lower testosterone is, the higher the risk for cardiac episodes are going to be. And this is something that's relatively new. Men with low testosterone levels were 33% more likely to die. So, you know, I have to be honest, I've come from a position of not understanding testosterone probably 6 or 7 years ago to a place myself where I believe that adequate amounts of testosterone are going to create wellness and will have a positive influence on cardiac problems for men. Now here comes perhaps the biggest surprise for some men is that from testosterone their body is producing estrogen. And I know that that may come as a shock. When we do saliva testing to evaluate men's hormones, do you know that a man at 50 and a woman at 50, he usually has higher estrogen levels than she does. And so we know that as a man's aging, his estrogen is increasing. Now, estrogen isn't only for females. A man's body needs it too, but in smaller amounts. It regulates brain and sexual functions particularly. Now, estrone is E1 estrogen. It's primarily made in the adrenals, and it's made from androstenedione. Testosterone conversion to estradiol happens in both adrenals and in fat cells. And so we know that both those two hormones, estrone and estradiol, go back and forth between each other, but ultimately they end up as estriol, which makes up about 80% of the estrogen in both a man and a woman's body, and then ultimately would be eliminated in that form. Estrogen metabolism, however, slows as men age, and when you couple that with the fact that men are increasing in girth around the middle, which is where this estrogen is produced, and their body slowly metabolizes it, what we're seeing with, again, aging men is higher levels of estrogen. And we'll often see the fact that goes along with that is lower testosterone because their testosterone is going to produce estrogen. So the combination here of low progesterone because of stress, low testosterone because of an aging man's testosterone is going to produce estrogen, and elevated estrogen levels sets them up for what could seriously be called an imbalance of hormones. I want to quote a study that I found. It's a German study. German researchers have clearly documented a dramatic aging-related accumulation of estrogen in human prostate gland. So this work correlated estrogen accumulation and the presence of benign prostate hypertrophy, BPH. So the gradual and what doctors call normal, I call common, not normal, but the gradual enlargement of the prostate gland is probably going to be set at the feet of elevated estrogen, low testosterone, and low progesterone. Now, I haven't included on this chart DHEA. DHEA is a very important hormone, and where androstenedione, where pregnenolone is, it would you could put an arrow out that pathway and start a new line starting with DHEA. But DHEA ultimately comes in to the androstenedione line because that's the pathway it takes, DHEA to androstenedione, and then ultimately becomes estrogen as well. And I'll talk just briefly tonight about DHEA supplementation, but I'm not particularly in favor of it unless you've done a saliva test and know that it's needed, because again, it ultimately can end up as elevated estrogen in a man's body. All right, if everybody would look at this chart and maybe draw one of these on your page, the T box stands for testosterone, the P stands for progesterone, and the E stands for E2 estrogen, estradiol. The small box over to the left stands for DHT, dihydrotestosterone, which is a metabolite of normal testosterone. The word above the progesterone box is aromatase, and that stands for an enzyme that is produced, manufactured in the body that influences hormonal production, and 5-alpha reductase, which also influences hormone production. Then what I want you to do is to draw a line from the T box over to the E box. And then above that line, it would say aromatase. And I want to explain practically what's going on in a man's body. His testosterone is converting to estrogen under the influence of aromatase enzymes. Now, the amount of aromatase in a man's body is dependent on a couple of things. Number one, genetics. And number two, the amount of fat cells around the middle. Because those fat cells around your middle for men are what are producing aromatase enzymes, which are taking testosterone and storing it there and manufacturing it in the fat cells that are around your middle. So when a man increases in girth, two things happen. His aromatase enzymes start to kick into action. His testosterone is going to drop, and his estradiol is going to increase. Now, when estrogen levels become excessive, they influence testosterone. Always this goes up and down together. Estrogen will go up and testosterone will go down, but the influence is another enzymatic activity that stimulates whatever is left of testosterone to be converted to DHT, dihydrotestosterone. And 5-alpha reductase is that stimulating factor. Now, all of this process, testosterone to estrogen, estrogen to testosterone to DHT, all of that takes place and is supposed to take place to some extent. The problem becomes when it becomes excessive. Excessive DHT, for instance. We know that DHT is found in the hair follicles. When it becomes excessive, men start to lose their hair. If men aren't balding or losing their hair by the time they hit 60 or 65, when this starts to kick in to a greater extent, they will develop thinning hair then on throughout their lives, the rest of their life. The second thing that happens is benign prostate hyperplasia. That's just the normal enlargement, the common enlargement of the prostate gland. Now, there are physicians out there who believe that if a man lives long enough, everyone's going to have an enlarged prostate gland. I believe that BPH, benign prostate hyperplasia, is common. I do not believe that it's normal. In a healthy man with adequate hormone levels, too much of it shouldn't be converting to DHT. And so our goal will be to limit the amount of testosterone converting to DHT to what should be adequate, not excessive. And then lastly, prostate cancer. We know that prostate cancer is influenced by the amount of DHT. We now know with studies that it's not influenced by huge amounts of testosterone, but it is more influenced by large amounts of estrogen. And so the estrogen, of course, you know, the role of estrogen is to cause cells to grow, multiply, and divide. It would make sense that it would have some of that hyperplasia activity or cell multiplication activity in the prostate gland itself. All right, so let's go back now and let's talk about where specifically these hormones are made and what they do. So I'm going backwards now. We're going to talk about estrogen first. The estrogen in a man is made in his testes, made in the adrenals, and is made in his fat tissue. And we just showed you how that's done. Again, it's converted under the influence of aromatase enzymes in the fat tissue in our body. So we can't control what men's testes are doing. We can often not control what the adrenals are doing, but we certainly can control the amount of body fat that we acquire as we age. And it would be very important for most men to keep this to a low ebb. Estrone, E1 estrogen, is made from androstenedione in the fat cells of the body under the influence of aromatase enzyme. And this is a very potent estrogen. It is probably the main estrogen that's responsible for converting to estradiol and causing things like breast cancer in men and perhaps prostate issues. E2 estrogen is estradiol. Again, it is the strongest. Estrone is strong, but this one is stronger. And I'm quoting John Lee here. Excessive levels of E2 estrogen activate the liver to make more SHBG. That's the sex hormone binding globulin. In other words, it binds up testosterone. So too much of SHBG is, Dr. Lee believes, a marker for too much estrogen, and will also be a marker then for very low levels of free testosterone. Estriol is the mildest or weak estrogen. Its half-life is shown to be between 3 and 64 minutes, so it's very weak. Research suggests that estriol has benefits for bone density and heart health and so on. I think that it probably has and is used more for women, but I know that there is some estrogen therapy that's being given men for prostate issues, and if they do give estrogen, they should probably consider E3 because it never goes back up the pathway to become E1 or E2, and that's important, whereas E1 and E2 go back and forth between each other. What are the symptoms of estrogen excess? Well, weight gain around the middle. Insulin resistance, interestingly enough, because again, that will produce some weight gain around the middle. The beginning of prostate problems will be able to be a sign that perhaps the estrogen levels are too high, and erectile dysfunction. All right, let's continue and go back to our illustration here to talk about progesterone. Keep this in mind. So the man's body makes progesterone in two ways, basically in the adrenals and in small amounts produced in the brain. Adipose tissue does not make progesterone, and yet if you look at our chart, progesterone is right in the middle, and progesterone actually has a protective effect on estrogen in that it can stop or interfere with the aromatase conversion of estrogen to testosterone. Now, it can also interfere with the 5-alpha reductase production of testosterone to DHT. So progesterone becomes a very important hormone. It's really vital to a man's health. It's vital also because it's that primary precursor for cortisone, and it is a primary precursor for testosterone. Men, again, make hugely smaller amounts than a woman does, but nevertheless, it still is important. They make about half as much as a woman. Progesterone slows normal and abnormal cell growth while balancing the effects of estrogen. So I think that when we're looking at prostate issues for men, progesterone is going to play a role. Dr. Taylor talks about a study done at Johns Hopkins that revealed that women with progesterone deficiency were 54 times likely to have breast cancer prior to menopause. This study clearly illustrates that breast cancer is associated with progesterone deficiencies. I think we're going to find that there are approximately 12,000 to 15,000 men every year in the United States that develop breast cancer. And they develop breast cancer for the same reason as women do. Elevated estrogen and diminishing amounts of progesterone. So what about progesterone in men? Progesterone in men declines after the age of 60, and perhaps even earlier. We're seeing all of this hormone imbalance is really shifting a full decade. It used to be 70, then it went back to 60. In the 15 years I've been teaching, I would almost say right now that men in their 50s are showing a decline in hormones. Progesterone protects the prostate, and it lowers PSA. So we're going to find that it has a positive effect on the prostate, and that's what Dr. Lee talked about all the way along. It inhibits aromatase and 5-alpha reductase conversion, and in doing that, it stops testosterone from going to estrogen and to DHT, and it raises testosterone levels. Now I hope that you understand what that means. It has it antagonizes the effect that estrogen has to grow and multiply and divide cells in the prostate. And it stimulates the anti-tumor P53 antigen. Here's that guide again. Let's keep in mind now we've talked about estrogen, we've talked about progesterone. Now let's talk about testosterone and the role that it plays. There are two ways, basically, that a man's body produces testosterone, the primary ways, in the testes and in the adrenals. Testosterone has a huge influence over men, and on their skin, on their brain, on their bones, their muscles, on their sex organs. We cannot underestimate the fact that testosterone is probably throughout the majority of a man's life, it is the #1 hormone that influences where he's headed. Now, some symptoms of testosterone deficiency, and I've categorized them into mind, body, and sexual function. The mood change that men might experience when testosterone levels drop. And for the most part, we're looking at a drop in testosterone after 60. Now, again, you know, men in their 50s could be experiencing some of this as well, because we're starting to see an elevation of estrogen in our world that would correlate with a diminishing of testosterone as well. Concentration, tiredness, lack of energy would be characteristic of sort of a change in mood or a general malaise that a man might feel. With regards to what's happening in his body, reduced muscle mass, increased body fat, particularly around his middle, the beginnings of osteoporosis, where he's shrinking in height. He might have some swollen or tender breasts. You often see in men over 60 at the beach that they actually have the beginnings of breasts. Though that's a sign that his testosterone is converting to estrogen, and ultimately hair loss. Now, we could put in here some physical things like prostate disorder as well, and certainly breast enlargement. Reduced sex drive under sexual function with erection problems. We could also put in here prostate issues. 3 of these hormones, and recognizing that all 3 play a role. So in a man's body, it's not just about testosterone. And if nothing else comes through loud and clear, I want that to come through. It's not just about testosterone. It's important to discern, where is the estrogen at for this man? Where is his progesterone? Now, I want to talk about the life stages for men. You know, at all stages of a man's life, steroid hormones are supposed to be present in optimal, or we could say adequate amounts for the age and stage of the man. But they can become imbalanced. So the 3 stages that we're looking at: puberty, midlife, andropause. Now, I'm not going to spend a lot of time on puberty. Most of us know that testosterone levels are at their ultimate high for adolescent young men. And that's just a given. We call that raging hormone years. At the same time, when they've evaluated estrogen levels, they are at an all-time low. And progesterone levels at puberty are in just a normal mid-range. So high testosterone, mid-range progesterone, and very low estrogen. Now, Dr. Shippen has written a book that is in the book list that I'm recommending, and it's called The Testosterone Syndrome. He's a medical doctor, and I think he's just fabulous in what he's put together. But he says, in fact, if testosterone were the culprit for prostate disease, then men aged 18 to 22 would have the highest incidence of benign prostate hyperplasia and cancer, as their testosterone levels are at the highest point. And, of course, young men don't get prostate problems, so as a rule. So I think that this is evidence well taken, and that men ought to be challenged and concerned about where their testosterone level is. In midlife, of course, that's when the decline starts. From the early 20s to the late 20s, testosterone makes its greatest drop, and thereafter it declines probably about 1% per year after the age of 30. Now, at the same time, estrogen is rising. And so, again, it's at midlife, somewhere between 30 and 50, that men start to gain weight around their middle, particularly if they're not exercising and they're not eating correctly. And we'll address some of those things, too, before the evening's out. Now, the last stage, which is the same kind of stage for men as it is for women, is called andropause, where the androgen hormones begin to decline. And I've quoted Dr. Shippen on this. I think that he makes the best points on andropause. They didn't know quite what to call it. It starts later for men. That's one thing to note. It does start later. Again, growing older has been associated with slowing down, but where women go into menopause approximately age 50, for men it's 60 to 70. The effects tend to be subtle, and men don't really notice what's happening until they reach maybe mid-50s to mid-60s. By about age 70, the decrease in a man's testosterone level can be as much as 50%. And it's interesting, again, Dr. Shippen says this, estradiol levels start to climb from the age of 50 and are at their highest point in the late 60s. But during the same period, progesterone levels decline as well. So we have, again, age-related, progesterone and testosterone declining and estrogen increasing. And he calls this imbalance estrogen dominance. So let's take a look at some of the symptoms of estrogen dominance. Now, again, for our purposes here, estrogen dominance in men is low testosterone, low progesterone, elevated estradiol. For women, that is not the picture. They see low progesterone, sometimes high, sometimes low estradiol, and normally in the average woman, we're seeing normal testosterone levels. So for men, their estrogen dominance is a little bit different, but it does affect men in these same three areas: mind, body, and their sexuality. If you look at the mind, testosterone helps to maintain a feeling of well-being. So that will diminish. As far as the body, it helps to maintain healthy bones and muscles, and you'll start to see a bit of wasting happening with men whose testosterone drops. And you'll start to see their body thicken under the influence of too much estrogen. As far as sexual function, this is probably where we're the most aware that we ever have been, but testosterone has a direct effect on erectile dysfunction and on just general sex drive. So let's go into each of these three sections and address it. I won't spend a lot of time, just very briefly. Declining hormone production can lead to mood changes in men. In fact, that's sometimes the partners what they observe the most. So when androgen levels begin to fall in the late 30s, early 40s, a man can experience some changes in energy, stamina, and drive, and that will continue to his 50s. It will become even more dramatic in in the 60s if there is not an intervention program. Depression, mental fatigue, sort of a feeling of burned out are all symptomatic of andropause. When progesterone and testosterone levels decrease, but estrogen stays high, the common scenario in andropause, a man can become estrogen dominant. And in your life, you want to start questioning and thinking in terms of, well, we should get this guy's hormones tested. The second thing that is affected is where the body's at. So you'll be noticing an increased layer of body fat, particularly around the middle. His muscles, it will be harder for him to produce muscle because, again, the main muscle-producing hormone is testosterone, and if he's got that in a reduced amount, it's going to be very difficult. Excuse me. He might show some signs of osteoporosis. It's not uncommon for men in their late 50s, 60s, and 70s to show diminishing height. They'll lose inches because their bone density is diminishing. And again, I think we're going to be able to look at progesterone having a positive influence on osteoblast activity here. So in order for prevention of osteoporosis, a man, just like a woman, needs a balance of all three hormones, a balance of testosterone, so adequate testosterone, adequate progesterone, and adequate estrogen, not excessive. Low thyroid function is going to be also a problem in the same manner that we see it with women. And I want to focus in on low thyroid for just a moment, because I think what tends to happen is men are less inclined to go to the doctor, and they're, as a result of that, receiving less attention for thyroid conditions that they might have. And so evaluating their thyroid often isn't happening for men. But some of the symptoms of low levels of thyroid hormone would be hair loss, fatigue, dry skin, weight gain, constipation, and cold intolerance, some of the same things that women are facing. And if a man is having these symptoms, if he went to his physician, told him he's having these symptoms, they would probably put him on a Synthroid drug as well. Asking these questions, of yourself, I think is real important again. Brain fog is one of the issues that I think men suffer from as much as women once they get into that 50s and 60s category. Losing weight becomes a real big issue as well, and so does having lots of allergies affect them. What happens with going on Synthroid is the fact that they've only really targeted one area. I want you to look at this hormone pathway. When they do a test for a man who comes with those symptoms, the physicians will usually test the TSH level, and that tests thyroid stimulating hormone. And basically what they're looking at here is they're not actually testing the amount of circulating thyroid hormone in the bloodstream. They're just evaluating, how effective is the brain at sending that signal to have the thyroid produce hormones. Now, in this pathway, the thyroid receives the message and starts to produce T4, which is an inactive hormone, and which also needs to be converted to T3, which is the active hormone. Now, by giving a person who shows a high TSH, high TSH means the thyroid is being overstimulated. So that means that it doesn't have enough T4 that's being produced. So they will usually give Synthroid as the medical prescription of choice. Synthroid is primarily T4. Now again, T4 has to convert to T3. The main ingredient that causes that conversion is iodine. And so what we have done is we've taken a different look at the thyroid. Our look at the thyroid is, what if we give a person a test for iodine levels, and we see that the iodine level is insufficient? What will that correct? Well, look at the symptoms of low iodine. They are very similar to the same symptoms of low functioning thyroid. And what we've seen is if iodine levels are insufficient, not enough to convert T4 to T3, they can give you Synthroid forever, and it's not going to bring up your T3 level if you don't have an adequate amount of iodine. We've discerned that iodine is important in men's breast health as well. We're seeing certainly an escalation in the number of men that are having surgery for breast cancer, for the number of men that are developing breasts, and the number of men that have cysts in their breasts. We believe that just as it is for women, iodine is a factor for men as well. And so discerning the iodine level of a man for thyroid function and for breast health, I think, is very important. Testing for iodine insufficiency, it's a simple 24-hour urine test that can help to determine if your levels are sufficient or not. That test can be obtained on our website, helpforhormones.com. The resolution to that, if your iodine level is insufficient, going on iodine pills at 12.5 milligrams per dose is very inexpensive. It would cost less than $10 a month. So resolving an iodine insufficiency, supporting the thyroid and having the thyroid function better is going to help the man hormonally as well. Let's move on to the third area, and that's sexuality. Now, sexuality in a man is directly connected to his elevated estrogen and his low testosterone. Low sex drive. In other words, almost a lack of interest in sexual activity. And that's surprising considering the interest level that men had in their years after puberty and even into midlife. So it often is a dramatic change. There could be low sperm count. There could be breast enlargement, as we talked about, and possibly breast cancer. Erectile dysfunction. In recent years, the popularity of drugs like Viagra, has made erectile dysfunction almost a household name. But as I look through the information, number one, I'm coming up with a few things that I didn't know before. In many cases, estrogen dominance, an imbalance in which there's not enough testosterone and progesterone in relation to estrogen, is a factor in erectile dysfunction. The other clue, and this has been recently in the media, but many aging men remain unaware of the link between erectile dysfunction and vascular disease. So cardiovascular disease is definitely connected to erectile dysfunction. So if a man's having erectile dysfunction, we need to address the issue of cardiovascular health for them. Both erectile dysfunction and heart disease have been linked to impaired nitric oxide activity. And so the ability for the body to produce nitric oxide and dilate the arteries, that seems to be impaired in both erectile dysfunction and in heart disease. But in 1994, there was a study in Massachusetts that established erectile dysfunction as a plague stalking American men. And there were 1,290 men aged 40 to 70. 50% of the men over 50 and 70% of the men over 70 had erectile dysfunction. I think that it's going to become more and more of a problem if we don't resolve the hormonal imbalance that's in behind that. So, again, the production of nitric oxide, the diminishing of testosterone, the increasing of estrogen all play a role. Now, certainly, because a man has low testosterone, he is also at greater risk for heart disease. And I know that that might come as a surprise as well, but low testosterone and heart disease are connected. In fact, reading Dr. Shippen's book, he gave a lot of research that's been done in China where they were giving men who suffer from heart disease testosterone, and it resolved angina pain. It corrected their heart episodes immediately. And I think that perhaps, men, as they're aging, the number one reason to maintain testosterone levels isn't going to be to maintain sexuality so much as to maintain their heart health and continue to be healthy. Prostate and prostate enlargement. There is no question that it makes sense to us that elevated estrogen can play a role in enlargement of the prostate gland. Just to give you a little to me. And, you know, physicians continue to have the misconception that high testosterone levels cause an increase in prostate cancer. When, truthfully, medical studies, the ones that I've been looking at least, show the actual opposite. And if you can think in terms of the teenage boy who has high testosterone, he doesn't develop prostate disease. In 2004, Abraham Morgentaler, a medical doctor, published a review in the New England Journal of Medicine validating that there was not a single study in human patients to suggest that raising testosterone levels increased the risk of prostate cancer. And his premise was further validated in 2008 with an article published in the Journal of National Cancer. So I think that physicians are going to have to change their concept of what's causing this as well. It certainly can be put at the feet of a hormone imbalance, but not necessarily elevated testosterone, more than likely low testosterone, low progesterone, and elevated estrogen. I think John Lee, you know, had the best sort of position on this. Prostate cancer occurs more often in men with low testosterone than men with higher testosterone levels. That's a quote from John Lee's book, Hormone Balance for Men. Maintaining good levels of both progesterone and testosterone should be the goal of men for preventing and treating prostate issues. So if you're thinking about this, you might be wondering, well, how come? What is causing this? Well, if too much testosterone is converting to estrogen because of men gaining too much weight, so the overproduction of estrogen, the insufficient production of testosterone, progesterone is supposed to protect prostate tissues, supposed to protect the body from converting too much estrogen to too much testosterone to estrogen. It's not in prevalent supply. Insulin resistance will cause a diminishing of testosterone in men. Now, we're eating way too many carbs, way too many processed foods, and we're not eating in a ratio of 40-30-30, which is real important to balancing hormones. You saw the role of stress. Stress will deplete progesterone levels, and which in turn will deplete testosterone levels. A lack of good nutrition. You know, fiber helps with insulin resistance. We'll talk a little bit about this in a moment. There are phytonutrients that actually act as anti-estrogens that should be utilized in every man's diet. Chemicals and pollutants in our environment can raise the estrogen level, and that, in fact, may be happening as well. So what are the medical community offering? Well, there are drugs on the market today that help to inhibit 5-alpha reductase. Now, there are aromatase inhibitors, drugs that do that. Finasteride, for instance, is one drug. Some of the side effects of that drug. Now, it does prevent the conversion of testosterone to DHT. There is no question. Some physicians believe that it is too effective, that it causes no DHT to be produced, and whereas we know that some has to be. You know, this process is needed to some extent. It's just not to the greater extent. But some of the side effects of that drug, Proscar would be one, would be impotence. It sometimes creates gynecomastia, which is the enlargement of the breasts. Sometimes it causes abnormal sexual function. It can cause ejaculation disorders, and it can cause erectile dysfunction. Now, what man in his right mind would want to take that drug? Now, Merck, they make the same kind of drug for meant to use for hair loss. So the same thing applies. If we could stop the conversion of testosterone to DHT to the greater extent, they would be able to stop hair loss in men. And so they've made two products, one Proscar, which is used for the prostate, and the Propecia, which is used for hair. Again, there are physicians out there that say the side effects don't warrant the use of it, and it could interfere. Now let's talk about aromatase drugs. Arimidex is one, and doctors will very quickly recommend Arimidex. Now Arimidex works on the other part of the chart. If you can remember the testosterone conversion to estrogen, it stops the aromatase conversion of testosterone to estrogen. And certainly it is effective. Again, some of the side effects: diarrhea, constipation, nausea, vomiting, loss of appetite, headache, hot flashes, dizziness, dry mouth, back pain, and cough. Then it says notify your doctor if you experience breathing trouble, rash, shortness of breath, chest pain, pain or swelling in the legs, swelling in the feet or ankles, weight gain, tingling in the hands, and depression. I took that right off their website. So again, the medical options are very dramatic. They are not without side effects. I think it really is important to note that there aren't any drugs on the market that are without side effects. It goes without saying the drugs for erectile dysfunction, there are basically three main ones: Cialis, Viagra, and Levitra, which the doctors tend to go with, and they offer mixed results. They are not a cure-all. They actually act as a Band-Aid. A Mayo Clinic professor of urology, Dr. Nira, recently told the New York Times the medications do not work for about half the men with erectile dysfunction. So, it's a Band-Aid solution, not necessarily something that men want to use on an ongoing basis. I believe in correcting the underlying problem. And they don't, these drugs don't do anything, the erectile dysfunction drugs, to treat the chronic endothelial dysfunction, which is one of the main problems. The fact that there's a vasodilation problem and a problem with probably the vascular system throughout the body. Then we can move on to the surgeries that are being offered men as an option. The transurethral resection is where if the cells in the prostate gland close and enclose the urethra, what they do is they go up and sort of with a bit of a roto-rooter to root out those cells. And that's really just a Band-Aid as well, because again, those cells can regrow under the influence of excess estrogen. So the next step would be a radical prostatectomy should cancer develop. When it comes to testosterone replacement therapy, it's still very much a mixed field out there. And doctors are, I would say the word reticent is probably the best way to describe it. My husband's physician is not really up on this at all. And, he knows that I am. So that causes a little bit of stress. But my husband has a very good working relationship with his doctor. And I'm coming to the position where if your saliva test as a man shows that you need testosterone, then that would be definitely the way to go. There are a variety of ways to take in testosterone. The principal, there are probably 5 ways: injections, lozenges, patches, gels, creams, and pellets. And there have been various success stories with any or all of those methods. The injection one, according to Dr. Shippen, is still the most common. Doctors don't realize, but he believes it's infinitely the worst. And it makes sense because an injection of testosterone will give an immediate full treatment of testosterone that will subside rapidly. The idea of having a delivery system that delivers a nice even balance of testosterone if a man needs it, in the same manner as using a little bit of progesterone would be appropriate. So, you know, an injection will rise testosterone levels too abruptly, and often in huge high doses, non-physiological dose. So for anyone listening to, you know, we don't, and you would want to read Dr. Shippen's book, Aspire to that. Lozenges have a drawback that, again, they spike the hormones. After 5 or 6 hours, the hormone levels begin to fall. And so both of those two are, you know, are iffy. There are patches, just as there are estrogen patches for women, there are testosterone patches. The downside of that, it's a great delivery system. It's topical through the skin, but men can get rashes from the adhesive, and I've found that women don't like the patches much either. And Dr. Shippen says that there's a limit to how much testosterone can be delivered through a patch. And so there seems to be an upper limit of 50 to 60 picos of testosterone that, that they can deliver. Most men want their testosterone levels somewhere between 80 and 100 picograms per mol. And I think that for any man between the age of 60 and 80, or 50 and 80, between 80 and 100 is an excellent goal. And so the patch wouldn't get most men there. So that leaves us with gels and creams and pellets. Now, I personally have more experience with the gels and creams. A pellet it dissolves. It has to be implanted every 4 to 6 months, and it's shot into the butt of a man. And it has some positive benefits, but that would only be under the guidance of a physician who kind of knows what they're doing. But that might be a good delivery system. In lieu of that, I'm very familiar with creams and gels. There is a website, androgel.com, for a gel, and the creams are, for the most part, manufactured by a compounding pharmacist. In all cases, testosterone replacement therapy can only be done and accessed in connection with a physician. So I encourage all men to develop a relationship with your physician. We'll come back to this in a little bit, but I want to talk about the natural solutions to balancing hormones for men that are estrogen dominant. And I think that tonight's presentation should emphasize the need for, number one, education. We have a great DVD, which if a man watches it, they just substitute the word for testes for ovaries, and prostate gland for uterus. Prostate and the uterus are the same genetic makeup. And so if they do that, then they'll get a good idea, because, you know, although I don't talk a lot about testosterone on the DVD, they'll get an idea of the progesterone-estrogen connection. Accessing this webinar by becoming a member of Building Strength webinars, I think, is just a great idea. We have a book list at the end of this presentation, so anybody who's purchasing this information tonight will have access to all of that. Or you can send me an email at helpforhormones.com. Evaluating your hormone, well, education includes watching the DVD, but evaluating your hormones then becomes the next most important part of the process, because you can learn about it, you can listen to the seminar, you can watch the DVD. Until you actually do a saliva test, you don't know what your hormones are doing. And we use saliva testing over blood. Now, with testosterone, the free testosterone and in the blood, the free testosterone saliva are very close. But I've now done a number of evaluations. I tell men, go and have a blood test if it's covered by your medical. Go and do a saliva test, and then we compare them. I'm still more confident with the saliva test, and I'm more confident once the man goes on a program. With saliva, it's possible, again, to get a very accurate read. And it is reading the bioavailable or the free hormones that are circulating in the body. For a man, he would test if you think the symptoms that we've covered in this webinar are related. If he's developing osteoporosis, you want to know why. Do a test. He tests testosterone, estrogen, and progesterone. If you think that you need a balanced program, test first. It's very motivational to go on a program after you know that you need it. If there are men in the audience who are already on testosterone, progesterone therapies, they should be evaluating annually. Nobody wants to be on hormones and not be personally responsible and accountable for evaluating your own hormone levels. And to every single man who's on this call tonight, you should be testing every year. And we'd like men to start in their mid-40s so that we have a baseline, something to compare to. And again, you can determine if you are at risk for prostate disease by the results of a saliva test. Men can use 2 of our 3 tests that we have available. A 3-panel test tests 3 hormones, and that would be, of course, appropriate for any man who is concerned about osteoporosis. If prostate issues or stress are indicated, then a 5-panel test would be appropriate. Testing is simple. It's a small box that arrives in the mail. It's about 5 inches by 6 inches. It contains 4 tubes, very tiny tubes. So you spit in the tube before breakfast, lunch, and before bedtime and dinner. Make sure that you seal the tube well and mail off the samples to the lab. Results within 7 working days, so usually it goes into the 2-week mark, and you receive your results by email. If the results show that your hormones are out of balance, then the next thing is to get on a program to balance your hormones. Now, I come back to this. What program is going to balance hormones? Well, it's a program that's going to address testosterone, progesterone, and estrogen. If your program doesn't address all 3 hormones, then it's not a valid program. And my challenge and concern with doctors that are out there that are prescribing testosterone, they're not addressing the low progesterone and they're not addressing the elevated estrogen. And so if they're not, then what could be happening is they could be giving men testosterone and having it again convert to estrogen and increasing DHT. So a program should involve balance of all 3 areas. Balance estrogen, and that's done with nutrition. We'll deal with that last. Balancing progesterone, increasing your progesterone level with a bioidentical progesterone cream for men is appropriate. And then increasing testosterone levels. Now, if a man is under the age of 55, usually, or if his testosterone level is above 30. For men whose testosterone levels go below 30, they should be on testosterone program, perhaps 40, anyone below 40. But the average man who's 40, 50 years old, even 60 years old, who has testosterone levels above 40, all they need to do is exercise and eat right. They don't need to do bioidentical hormones. Bioidentical hormone, testosterone, should only come into play once you know that testosterone levels are below normal. So let's start with progesterone. The same thing applies for progesterone for women as it applies for men. 400 to 500 USP grade progesterone. If you want a recommendation for a progesterone cream, I have one that is made for us in an aloe vera base. It's made in the right amount. And usually somewhere between a 1/16 and an 1/8 of a teaspoon for a man in the evening is applied. And again, they apply it to areas in the body that have veins and capillaries close to the surface of the skin. And if a man has a partner who's using progesterone, then they should cycle their progesterone together. All men and women take 1 week off. With regards to progesterone therapy, men should establish a 100 to 200 or approximately 100 to 300 ratio with estrogen. So say a man does a saliva test and his estrogen level is outside the range. It's higher than 1. Anything higher than 1 is elevated. So say his estrogen is at 3, and I've had this happen. Then his progesterone level needs to be multiplied by 200 or 300. So he should have 600 to 1,000 progesterone to protect his tissues from estrogen excess. So for every 1 estrogen, he needs 2 to 300 progesterone. Now, the reason we want to elevate progesterone, again, just to go back over, it protects the prostate, it helps lower PSA levels, it inhibits aromatase and 5-alpha reductase conversion of testosterone to estrogen and testosterone to DHT. It stops that stimulating effect of estrogen that estrogen has on the prostate gland. It works in the brain to help with depression, and it actually promotes normal cell death, apoptosis, so that cancer can't grow there. Testosterone therapy, the criteria would be a bioidentical cream or gel. Androgel would be a bioidentical gel. A bioidentical cream would have to be made at a compounding pharmacy. The general dose that most physicians talk about is a 20 to 25 milligram dose once a day. Now, some doctors like that in a divided dose, so approximately 10 in the morning and 10 at night. Again, it would be applied to the areas on the body where the skin is thinnest, where there are capillaries and arteries. You want to offset it with where you put progesterone. And then as long as you're using testosterone and progesterone, you need to be retesting with a saliva test, probably every 3 to 6 months to make sure that testosterone is not converting to estrogen. Testosterone therapy, I think the goal is to establish a 200 testosterone to 1 estrogen ratio. So again, you know, ratios are real important with this. And again, it protects the prostate gland, it lowers PSA, it does all the same things that progesterone does. Testosterone and progesterone are going to work in tandem in a man's body. Now, the potential benefits of including testosterone therapy is that it will improve muscle mass, it will increase bone, it will improve sexual desire, it's going to thicken hair, it's going to improve skin, decrease irritability, improve cognitive function, and particularly if you do this in cooperation with thyroid, iodine. Boosting energy. Now, I can't say enough for testosterone therapy, but men who want to just raise their testosterone levels without using testosterone, and men under 55 should do that, can do some of these things, all right? They can lose body fat, because when you lose body fat, you're going to be producing less estrogen, more testosterone stays as testosterone. Gain muscle, get into the gym and lift weights. It's very important because that improves testosterone levels. You need to do enough work to trigger testosterone response, but not so much that it causes fatigue. Proper rest with your workout will help your body produce testosterone. Eating the right diet, you know, some things that will help. Monounsaturated fat, like the fat found in peanuts. Monounsaturated fat in research shows that men who ate peanuts, for instance, had the highest testosterone levels. So, I mean, you don't want to eat lots of fat, but nuts and seeds are very good. They're also probably high in zinc, which also interferes with the aromatase enzyme. Alcohol lowers testosterone levels, so moderation is the key. I hesitate to say this next one because I hope the women don't get after me, but men that have more sex triggers the body to produce more testosterone. And so, that should be great news for the men in the audience. So, I guess my only suggestion is to have a discussion with your partner to step up the action for the sake of your testosterone level. Dr. Lee, and this is a quote from his Hormone Balance for Men, maintaining good levels of both progesterone and testosterone should be the goal of men for preventing or for treating prostate cancer. And I think that goes without saying. Now, Dr. Lee always has three prerequisites for anyone who's going to do hormones, whether it be progesterone, testosterone, or estrogen. Number one, only use hormones if you know that you are truly deficient, and that means do a saliva test first. Number two, use bioidentical hormones rather than synthetic hormones. There are lots of synthetics out there, don't go near them. And use only dosages that match what your body would normally find in tissues. And so that's where the 10 to 20 milligram dose of testosterone comes in twice a day. That's where the 5 to 10 milligrams of progesterone comes in, because that's what your body would normally produce. Let's now get to the crux of the issue, and this is the part that most don't deal with. It's easy to give somebody progesterone. It's easy to give somebody testosterone. It's more difficult to modulate and stabilize estrogen levels. So we start with good nutrition. Eating 40% carbs, 30% protein, and 30% essential fat is the way to eat to balance your hormones. If you want a really good book on the subject, the book, The Formula, is excellent. And it teaches what a plate full of food looks like. That's 40, 30, 30. But their perspective is that every mouthful of food, every snack, every meal that we eat should contain 40% carbs, 30% protein, 30% essential fats. Now, the carbs that we're talking about are number one, vegetables first. Number two, 2 fruit, probably no more than 2 fruit in a day because it's high in sugar. And number 3 would be whole grains. So the idea is that eating 40, 30, 30 very gently stimulates blood sugar, but it doesn't throw it off the map. Starting with a good balance of nutrition, eating 40, 30, 30 will cause most men in this audience to lose weight. And losing weight around the middle becomes the beginning, that's the start to bring hormonal balance. Remember that much of this conversion of testosterone to estrogen takes place in our fat cells. So reducing the amount of body fat will help lower estrogen, will help increase testosterone. Now, we'll talk about some of the interfering factors with the aromatase conversion of estrogen to testosterone, because there are some really good things that interfere. Number one, let's talk about fiber. Stabilizing estrogen, removal of excess estrogen, all hormones actually ultimately reach the bowel. And so as long as somebody is on a program to stimulate or to increase their testosterone, progesterone, and to diminish their estrogen, they need to increase their fiber intake, anywhere from 30 to 50 grams a day. And we do that with a fiber supplement for 2 reasons, because it lowers estrogen and because it stabilizes insulin levels. The recommendation that we give to anyone who's concerned about weight gain is to take a teaspoon of our fiber supplement before breakfast and before lunch and before dinner, because again, it slows up the insulin spike that could take place, and it actually pulls out excess fats, excess sugars, so that the body doesn't have to deal with it. Fiber is really important next to a good nutrition program. Drinking water and exercising are very important. Both eliminate excess estrogens through excretion pathways. If you think about it, the excretion pathway to eliminate excess estrogen when we take in fiber is going to be the bowel. The excretion pathway when we take in water is going to be the kidney. And the excretion pathway when we exercise is going to be the skin. And so if you kick all those eliminative pathways into activity, then your body will not hold on to excess hormones. Now, men need to exercise for some other reasons. It does help improve mood. There's no question it helps manage weight. For men, it improves testosterone levels, and it helps to boost energy levels, and it helps men to sleep better. And so if some of those are a problem, get in that gym, get out and start walking and moving your body 30 to 45 minutes a day. The adding of vitamin C to our hormone balancing program comes for two reasons. First of all, for adrenal support. When the adrenals are busy taking progesterone and converting it to cortisol because you're under stress, they can burn out. And so the body's main nutrient, main requirement is vitamin C. So making sure that you improve vitamin C intake for adrenal support is, first of all, important. So anybody who's stressed out there ought to be taking anywhere from 1 to 3 grams of vitamin C a day. At the higher end, if you're on ongoing support, ongoing need for adrenal support. The second reason to improve vitamin C intake is for hormone support. And Dr. Shippen says this in his book. It's been known for many years that vitamin C is essential for the formation of the basic steroid hormones of the adrenal glands and the gonads in both sexes. Low levels of vitamin C increase levels of aromatase. We want aromatase enzymes to be low, not high. So improving vitamin C intake. So when we look at our three squares, testosterone, progesterone, and estrogen, and we see the arrow going across from testosterone to vitamin C, or over to estrogen, one of the interfering factors is going to be vitamin C. And we go with Dr. Brownstein's discerning that we should be taking up to 3 grams a day. By the way, Dr. Shippen in his book says the same thing. The next thing to do is to increase the indoles in the diet, broccoli, cauliflower, cabbage, and kale, because they contain an ingredient called indole 3-carbinol. And these ingredients do all sorts of good things in the way of eliminating estrogen. So this is another ingredient that interferes with the 5-alpha reductase conversion of estrogen to of testosterone to estrogen. So taking an indole supplement, eating 2 to 3 servings of cruciferous vegetables every day, all of these things help our body to eliminate estrogen via the liver. This is particularly important for men who have increased in girth. It inhibits bad forms of estrogen from causing things like prostate disease and breast cancer. So it actually protects estrogen-dominant cancers, including breast and prostate cancer. Now, the product that we've manufactured also contains DIM, which is a further metabolic process of indole 3-carbinol. And we've added DIM, enough DIM, because some people's digestive tracts don't automatically convert it. But there are 2 papers that I've shown at the end of our presentation here that report that DIM significantly halted proliferation of androgen-dependent human prostate cancer cells. In one study, androgen-dependent prostate cancer cells treated with DIM grew 70% less than untreated cells. So we know that DIM can also inhibit DHT. So indoles work on the DHT side of suppressing that testosterone conversion to DHT. And in doing so, protects the prostate. Increasing just the general nutrition in our diet, using a fruit and vegetable concentrate to fill the gaps in the diet. I find lots of people tell me that they eat really well, and I kind of chuckle because we probably wouldn't be talking if that were the case. And when I look at the weight of people, I know that they are eating very well, but they may be eating a lot of empty calories. So the idea of using a fruit and vegetable concentrate to fill in the gaps, and it's a whole food supplement, I think is very, very wise. Using a moderate amount of calcium. I know that men develop osteoporosis. There might be the tendency to run out and start to consume 1,500 milligrams of calcium. Our perspective is, in a healthy diet with lots of fruits and vegetables, green leafy vegetables, you will get about 1,000 milligrams of calcium. If you're going to supplement, don't supplement more than a couple hundred milligrams of calcium. And we put 250 milligrams of calcium in our Daily Max supplement and made from seaweed, a plant form, so that it's better absorbed by the body. Something that's different for men that plays a role is the use of an L-arginine supplement to assist with improvement in cardiovascular health. We've talked, about Viagra and Cialis and some of those drugs that are really acting as Band-Aids, dilating the arteries. What we want is something that's long-term, that's going to treat the cardiovascular system, but produce long-term health. L-arginine is one of those supplements that improves nitric oxide production in the body. It actually stimulates the pancreas to release insulin, and it's used to make the pituitary hormone vasopressin. And in doing that, it regulates the production of growth hormone. So it has a hormone connection for us. Now, the FDA have actually approved the use of intravenous arginine to evaluate those with suspected growth hormone deficiency. Now, by taking L-arginine at night before a man goes to bed, it will help to stimulate growth hormone production, which overall creates wellness for the man. The body needs arginine, however, to produce nitric oxide so that the blood vessels can relax and dilate. And that is the main function in erectile dysfunction, that we need to use arginine instead of Viagra or Cialis. There are no side effects with using L-arginine in this manner. They actually call L-arginine the natural Viagra. And, again, preliminary studies indicate that arginine may be useful in the treatment of angina, atherosclerosis, coronary artery disease, erectile dysfunction, migraines, and other conditions that are linked to reduced blood flow throughout the body. So we have been advocates for a couple of years now of improving L-arginine supplementation for men and women. We actually have put our arginine in a pomegranate base, which acts as an anti-estrogen. So we're using it as a very strong hormonal component. Seeing the connection with erectile dysfunction and cardiovascular disease, with men that have a problem, L-arginine is something that they need to look into. I don't want to belabor this, but it can help to produce and boost the activity of sperm for men that are having infertility problems, and that seems to be a huge problem. Do you know that the sperm count in men has dropped since 1938 by over 50%? And that, they believe, is due to the elevated estrogen level in our world. I would be remiss if I didn't cite new things that are happening. Certainly vitamin D3. I haven't gone into a lot of overview on vitamin D3, but we can foresee that vitamin D3 is also going to exert a cancer-preventing effect because it counters the effect of estrogen. And I think we're going to see more and more use of vitamin D3. We actually have 5,000 milligrams of vitamin D3 in our arginine supplement, and we have vitamin D3 in our Daily Max supplement. We have what's called a balance pack. I'm not going to spend a lot of time on this. You can go on to our maxalive.com website and have a look at products. You won't be able to purchase there unless you have an ID number from one of our consultants. So if you're on this call and somebody's invited you on, go and ask them if you want to purchase or if you want to move forward with a hormone balancing program. Let's review. A lot of information tonight, some of it new for some of you, I'm sure. A saliva test is imperative. If you're beginning or beginning to walk a path to finding out what your hormones are doing, you will need to have a saliva test. And we're offering to anyone who's on the call as a member or an adherent to Building Strength webinars, we'll provide a free review with one of our consultants if you tell us when you order that you were on the webinar, or send me an email to say that. Step 2 is to eat the very best that you possibly can. The best food choices are 40-30-30. Get a hold of the book, The Formula, and change your diet. This is important for the rest of your life. Supplement with a focus. I know a lot of people buy the latest sort of fad that's out there, but this is supplementing with a focus. Our fiber supplement, vitamin C, now we have the indoles, the calcium, and the fruit and vegetable all in one pack. So fiber, vitamin C, and what we would call Daily Max, and a little bit of arginine are really all that anyone needs in addition to bioidentical hormones to balance their hormone levels. For most men, maintaining their testosterone levels is going to be simply a case of exercising and eating correctly, making sure that you're supplementing with indoles to interfere with that testosterone converting to DHT, and making sure that you're eating vitamin C and to interfere with the testosterone conversion to estrogen. Eating a proper diet, maintaining your weight, all help to reduce estrogen levels. For those of you who can't manage that or are beyond the age limit, or whose testosterone levels have fallen below 40, you can use bioidentical hormones. Then you would need to develop a good relationship with your physician to make sure that that you're able to access a testosterone product. I have a number of men that are on this exact program, and what you have to recognize when we're looking at this page, that we've put together a program that addresses progesterone, that addresses testosterone, and addresses the estrogen issue, which is a huge issue. The supplement program addresses estrogen, and it's not an option. For the men that I talk to, I will not let them have progesterone. If their doctor gives them testosterone, that's up to them, but I don't want them on a program unless they're dealing with all three areas. They can have testosterone, but they must use a little progesterone, and they must use the supplement program that goes with that. And I think truly that makes perfect sense. You know, your age is only a number. And my husband and I have adopted the policy that we're going to live our life, we're going to forget our age. My husband looks 20 years younger than he is, and we both feel healthy. But this is what we have done. We have accepted responsibility for our own health decisions, and for those that we've made in the past. And we've begun to take responsibility for our own current hormone health. I truly believe it's only then that we can begin to move forward towards true wellness. So I leave you with maximize your life and balance your hormones. Now, if you want to learn more, we have a DVD that is available. We are looking for consultants, and so if you would like to help men and women with their hormones and hormone health, I do all the training, and we do the training by telephone. We have an excellent program. We have excellent records and stats that we have. We have available probably more information than most people want, but we believe in our process of education, evaluation, and moving forward on a program. We have a seminar book list that is available. These are some of the books. I'll leave this up here for just a moment for you to have a look at. And again, Dr. Lee's book is about breast cancer, but it has its application for men. Hormone Balance for Men is an excellent booklet, as is the Testosterone Syndrome. Very excellent. And Dr. Jonathan Wright has a book out that is very good as well. I know that there are lots of others, but these are books from physicians that I highly regard, and they're not over the top. And yet the information that I've provided this evening is more than what you'll get on any of those books. I have 4 pages of references, lots of references. And so I think that we'll go back and maybe leave it here for now, and perhaps we should start taking some questions. David?
Jackie, thank you, thank you, thank you. Can you hear me okay?
Yes.
Okay, great, great. Oh, this has been so informative. Folks, if you have any questions, please type in the chat box in the floating panel to your right. I know many of you on this call, on this webinar, are familiar with that. Jackie, as a matter of fact, there's because you're an organizer, you can actually check the questions there yourself, but I can read them out. Apparently, only one question came in with regards to the progesterone cream, and I think you've answered that, because they were asking with regards to, is it for men, is it in a pill form or in a cream form? And I think you answered that.
You know, pills are not always the best way to take hormones. So much of a pill is going to be metabolized by the liver. And so if you have a pill of any hormone, 90% of it is going to be shunted out, you know, as a metabolite. And so you'll only get the value of about 10%. And so we tend to stay away from pills or even troches or lozenges for that reason. So much of it will go through the digestive tract. Now, I know that some are under the tongue troches, but still some of it will get into the digestive tract. So we tend to favor a nice delivery system, which would be a cream or a gel.
Mm-hmm. Okay. And
that would be true for testosterone too.
Okay. And the barrier, the skin being a barrier, doesn't reduce the absorption.
You know, it's an amazing thing, David, but the absorption rate through the skin is better than anything. I know I've spoken to doctors who say that they can tell how much a body metabolizes from a pill, and I just laugh at them because everybody's digestive tract is going to be different. So I don't think that they really can. But we've done evaluations where we give somebody progesterone, they apply it topically to their skin, and we go to receptor sites in the breast, and we can see activity right away.
Oh,
I mean,
really?
Within seconds.
Really?
It's an amazing thing. So the skin, you know, especially if you're using skin that has, you know, is close to the surface, where you can see those lines and capillaries. So find, you know, it's not going to be good to put it where there's lots of body fat.
Mm-hmm.
So I don't apply hormones to my bottom, for instance.
So where would be the best?
Fat.
So the best places would be like in the groin area. I think you mentioned that once. Where else would you suggest?
Upper chest. Think of where you blush. Upper chest, groin area, inside of the arms, behind the knees, top of the feet, if you can see capillaries and arteries there. Certainly the face. The hands really absorb well.
So would you say it's best for people to put it on before they go to bed? That way it's not cleaned off or activity doesn't rub it off.
First thing in the morning and last thing at night. Most of the time we ask for progesterone application for men to be just at night. And then testosterone, doctors vary with this. Some want only a morning application because there's less chance of it touching the other family members.
Okay.
You have to recognize with all hormones there is a carryover, you know, so you want to wash your hands after you've applied it kind of thing. Not so much, it's not so critical with progesterone, but it is with testosterone. Otherwise you could be giving your wife too much testosterone. So, you know, applying it in the morning, and some doctors want to apply it twice a day. The people that I work with only use it once. They use their testosterone in the morning and their progesterone at night. And then they're doing their supplement program during the day.
Got it. Got it. Now tell us again why. Go ahead.
Well, I was going to say, this is the first time you've heard this too. And do you understand, like, why this is so different than what a physician is recommending?
Well, it is way outside of my experience for sure, but I'm open to learning from you and you explaining that to us as well.
Well, I personally feel that doctors should not be prescribing testosterone without making sure that there are non-drug aromatase inhibitors and 5-alpha reductase inhibitors in the program that they're suggesting. Because they normally wouldn't give those drugs to men that they give testosterone to. You see, I mean, I don't want all men to get Arimidex, for instance. You know, I would rather they use vitamin C as an aromatase inhibitor. I would rather they use progesterone as the aromatase inhibitor. Much safer.
Right, but there are reasons why they wouldn't want to go that way at all.
Well, I think part of it is they don't know about it. You know, they just don't know about it, and so
right.
You know, my concern is if they're going to just give men, you know, testosterone, they better have a program in place to stop it from converting to DHT and estradiol. And I think that's what's keeping most doctors from doing this.
Because they're not sure about it.
Correct. They
right.
don't know how to do the rest of the program. And you know, even in Dr. Shippen's book, he does not talk about the role that progesterone plays. Dr. Lee does.
Well, I'm glad you're giving us these resources to go check out and to really understand this. And I just wish there was a way to help to educate doctors, especially doctors that deal with these hormonal imbalances.
Well, you know, again, I don't feel that that's my role. That might be yours. But I'm not a physician. You know, I want the lay community to you know, be more informed. Right. Because I think that we have to become, on the whole hormone issue, we have to become our own advocates. If we don't, you know, we're going to see failing health. In doing the research for this, David, I've become more and more convinced that men that have cardiovascular disease often will have low testosterone levels. And with that, they'll have elevated estrogen. And so we should test their hormones.
So are we almost saying that low testosterone is associated with heart disease?
Yes. Dr. Shippen talks about the heart disease issue, and he names a study out of China where they gave men, I've got it right here, another international study comes from China where doctors decided to treat cardiovascular disease with testosterone. The Chinese researchers took 62 elderly males with an established pattern of chest pain, angina, and administered testosterone to half of them, while the rest consumed a placebo. After a 2-week break, they switched. The effects of testosterone were dramatically clear. Of the patients receiving testosterone, 77% had marked relief from anginal pain, with only 6% in the placebo group.
Wow.
Echocardiography demonstrated that blood flow to the heart improved in 68.8% of those receiving testosterone.
Wow. Now, do they have results, the same kind of results with women using testosterone?
You know, that women and testosterone, you cannot elevate a woman's testosterone without causing her undue problems. She doesn't like facial hair and deep voice, and
right.
it's not the same. You see, it's not the same.
Right.
Now, I'm going to quote him again. He says, I see heart patients all the time who have improved both functionally and biochemically with the aid of testosterone.
That is amazing. That is amazing. So you combine testosterone. So you combine testosterone and L-arginine, and you've got a winning combination, especially for men, huh?
Absolutely. And then you make sure that their estrogen doesn't climb, and their progesterone is adequate. And I don't see why. I mean, men wouldn't be just the healthiest. Now, I will say this about that: with the men that I have on this program, for the most part, they're over 70 years old. And you would never believe it, David. And I've taken men with their testosterone levels at 13 and raised their I mean, they have to do this through their doctor. I tell them what to say. They have to have a fairly good relationship with their doctor,
right,
in order to do this, because they have to go and ask him for a 20 milligram dose of testosterone. We provide the progesterone with an over-the-counter cream, and we provide the supplements to lower their estrogen levels. When we normalize their hormones, and I have one fella in Vancouver who's 71 years old, I mean, he is doing fabulous. His hormones are normalized, and he feels great.
Oh, wow. Oh, wow. So what do the doctors say about this when they get back, when they see this amazing recovery? What do the doctors say about this?
Well, I'll use my husband's doctors as an example. They just shrug their shoulders. They, oh, there's Jackie again. They don't want to get involved,
Well, Jackie, listen, we need to talk about how, doing programs for doctors who will be open to seeing this. And I need your thoughts on this and your advice on this, because this is something doctors need to know about.
Well, I believe that that's true. Now, the Compounding Pharmacy Association, PCCA, is doing a fairly good job of getting out there about bioidentical hormones and about saliva testing. What they haven't brought in is the nutritional component that I think is very necessary.
Absolutely.
In fact, I mean, it really is if you're going to modulate estrogen levels without drugs.
Right.
And that's our goal. I mean, we don't want to cause liver dysfunction.
Right.
So, the goal is to stay off drugs as long as you possibly can.
Of course.
And that's why the delivery system with hormones through the skin is real important, because that's going to miss the first pass by the liver.
And so that minimizes the burden the liver has to work through.
Correct. I mean, it all makes sense, doesn't it?
Yeah, absolutely. Boy, okay, someone asks, speaking about bioidentical hormones, someone says, if the bioidenticals are made by a pharmacist, what is the difference between synthetic and bioidentical?
Well, the synthetic hormones would be, an example would be what was found in HRT, Premarin.
Okay.
Premarin is made from horse's urine. Now, it's not bioidentical. People would challenge, though, and say it's natural. So I always say, watch the terminology here. All right? It is natural, but it's not natural to a human. It's natural to a horse. There are 18 forms of estrogen in Premarin that are not found in a woman's body. So a bioidentical hormone is manufactured. It has to be made somewhere, but it's made to identically mimic the hormones found in my body. And Dr. Russell Marker, back in 1938, discovered that from soy and yam saponins, you could, through 3 chemical processes, manufacture hormones that were bioidentical, exactly the same as my hormones. Now, the reason we don't have those in abundance back in 1938 is because they are not patentable. So all hormones are made from the same manufacturing process. So they just took Dr. Russell Marker's work, added a couple more manufacturing processes so that it was not the same as my hormone, and they could put a patent on it. So hence, you know, we have lots of synthetically derived hormones. Every birth control pill on the market is manufactured from a synthetic hormone, a hormone that was never and will be never found in our bodies.
Mm.
So that's how I denote the two. Bioidentical, hormones found in my body. Synthetic, hormones that were never found in that molecular structure in my body.
That makes sense. That makes a lot of sense. Okay. Okay. I hope that's clear to the person who asked this question in the first place. But I think that's really very well said, Jackie. Thank you.
Good.
Okay. Well, it looks like that covers the questions for tonight. I just want to ask one more question before we round it up. And I know you mentioned saliva testing, and you've said quite a lot about it. So, what can you tell us again? Why the saliva is the best place to get the results from than blood testing?
Well, first of all, the hormones that you want are not all of the hormones that are circulating in the bloodstream. We only really want to know how much hormone is available to the receptor site. And that represents less than 2% in the blood. So when we do a blood test, they don't differentiate between protein-bound hormones and those that are free and available. So it gives an improper picture. It does tell, a blood test will tell us all the hormones that are circulating in the bloodstream, but that's not the information we need. We need to know how much is actually available to the cell, and it's a very small percentage. So with saliva, because the hormones have gone through the tissue, and then we spit in a tube, it screens out only the bioavailable forms. And so we have this, the amount of hormone that's available to a receptor site that will be immediately utilized by a cell is the information that we want, and that's what we need. So when a woman does, or a man does a blood test, for instance, often it doesn't show the correct amount. Now, the difference with testosterone and men, so that is true for estrogen and that is true for progesterone. With testosterone, there seems to be, like a blood test for testosterone, Dr. Lee said, is relatively similar. Now, I have not found that to be true. We did a saliva test with one of our clients, and he was on doctor-prescribed bioidentical testosterone, and it showed that he had reached the 100 level. His had been 13 previously by saliva. It didn't show that much of an increase in the blood test. So I still feel personally more confident in the minute, you know, capability of saliva in reading what is actually available to the cell and not bound to protein. Now, there's lots of research. You know, there are at least 5 labs. I've worked with 2 of them in the United States, of the larger labs, and I've been solicited by a number of the other ones. And I've selected, you know, a lab for which we have a very good working arrangement. The lab is run by a physician who is a pathologist. So, you know, they've taken it to the next degree, and they are very good on educating. So if there are doctors on this call who would like to be educated, we can hook them up with our lab, and they will educate them very, very well.
And hopefully we should get the MD in charge of one of those labs to come do a presentation for us, right, Jackie?
Well, and that I'm thinking that if you feel that it would be warranted, if people would be interested, talking a whole evening on saliva testing, I'm not sure.
It's worth a try, huh?
Some of us like it, but I'm not sure. I'm not sure whether it would be a topic that your general clientele would be interested in.
Well, it's worth giving it a try, huh?
Absolutely.
Well, Jackie, thank you so much. This has been another very, very educative seminar, and I know next week we're going to have you back, so we're really looking forward to your presentation on ladies and balancing women's hormones.
Very good. Well, I love being here. You know, my goal is always to educate and train as many people as we can so that we can have healthy and well people. So by all means, I'm looking forward to coming again.
Absolutely, absolutely. Thank you again, and thank you folks for joining us tonight, and we shall see you on Thursday. Again, Dr. Sears will be talking about omega-3 fatty acids. Thank you again, Jackie. Good night, everyone.
You're very welcome.
Good night, everyone. Thanks.